I think the most wow effect is what is the first demand of the patient. His cheekbone is the first, area of treatment worldwide, not only for Caucasian women or men, but also worldwide. The second area, the second demand for the patient, it's tear trough, because it gives a tired look. So the patient asks for tear trough treatment, and they love tear trough treatment, but it's a tricky area. And the last one, the third one, it's lips. Lips, it's the future, because lips, it's attraction, it's the sensitivity. So even male and women patients ask for lips also. So this is a three wow effect. The main complication is the vascular compromise. It means that the hyaluronic acid can go in a vessel and do an embolism in the vessel with catastrophic consequences on the skin. So in this case, it's an emergency, and you have first to prevent, then to recognize, then to treat. Prevent, it's just the knowledge of the anatomy. Treat, it's just hyaluronidase in emergency before 6 hours. And also, what you have to deal is to deal with another kind of complication. It's nodule. And with nodule, you have a long protocol, and you have to know also that, but it's not an emergency. So first, vascular compromise, and then the second step is to understand the nodule and the treatment of the nodule. When you want to do a technique, everywhere, surgical, non-surgical technique, you have to learn this technique. A lot of people just have a look in a meeting like this and going immediately to do and to perform, this injection. So first you have really to understand what is behind, and to understand what is behind, you have to follow the Teoxane approach, A, T, P. So first the anatomy, because anatomy brings you the safety, then to understand the technique, and last but not least, you have to understand which product you will use. So if you have all these parameters in your hand, you will have much less complication.